Hello, I'm Dr. Thomas Gerber, a member of the staff of the Division of Cardiovascular Diseases and the Department of Radiology at Mayo Clinic in Rochester, Minnesota. I'm also a professor of medicine and radiology at the Mayo Clinic College of Medicine. Recently, I served as the co-chair of the writing group for the American Heart Association's scientific statement, Approaches to Enhancing Radiation Safety in Cardiovascular Imaging. Chair of the writing group was Dr. Reza Fazel, who is a cardiologist at Beth Israel Deaconess Medical Center in Boston. Our statement was a collaboration between the AHA Councils on Quality of Care and Outcomes Research, on Cardiovascular Radiology and Intervention, and on Clinical Cardiology. As evidence for the broad consensus that we have worked very hard to achieve on the controversial topic of radiation exposure in cardiac imaging, the statement is endorsed by the American College of Cardiology, the American Society for Nuclear Cardiology, the Society for Cardiovascular Computed Tomography, the Society for Cardiovascular Angiography and Interventions, and the North American Society for Cardiovascular Imaging. The important reason why the American Heart Association commissioned this statement is that, on the one hand, cardiac imaging is an incredibly important tool in the diagnosis and management of heart disease. On the other hand, some of the imaging procedures we use employ ionizing radiation, and we do know that overall, the total radiation exposure to the US population from medical imaging has increased sixfold over the last 30-some years. Our statement is meant both for the clinicians who refer patients for cardiovascular imaging procedures and for the specialists who perform these procedures. We outline practical and specific strategies how radiation safety in cardiovascular imaging can be enhanced by education, justification, and optimization. We also address existing barriers to implementing radiation dose reduction strategies. We make suggestions for how such barriers could be overcome, and we discuss priorities for future research. We wrote this statement with the American Heart Association's mission of building healthier lives squarely in mind, hoping to work towards a culture of patient-centered imaging, where the decision to use imaging and the choice of imaging modality is individualized for every patient in order to maximize the benefit-to-risk relationship of performing cardiovascular imaging in that patient. We also felt that it is important that we empower patients by involving them in shared decision-making on non-emergent radiation-based imaging procedures wherever possible. This means, though, that we need to devise strategies for efficient but effective communication of our knowledge about benefits and risks of these procedures, particularly for the difficult and complex concepts of radiation dose and the potential biologic risks of low-dose radiation exposure. But we also have a very important obligation to inform and educate the public and our colleagues in a balanced manner to avoid situations where appropriate and much-needed diagnostic imaging procedures are not done just because of ill-conceived concerns about radiation risks. We really hope you will enjoy reading our scientific statement and that this statement will encourage you to learn more about radiation protection for patients and what we all can do to help patients understand how imaging tests contribute to their health and to optimize the benefit-risk relationship of cardiovascular imaging for every one of our patients. Thank you very much.